Finance Minister Arun Jaitley, in his blog on 1st January, that is yesterday, wrote, and I quote, "The Ayushman Bharat scheme, which was launched on 23rd of September of 2018, has completed 100 days. These 100 days have witnessed the most significant steps in improving healthcare for the poor ever since independence." He further says in his blog, and I quote again, "In the first 100 days, 6.85 lakh patients have been provided hospital treatments." As per his blog, the scheme was launched on September 23rd of 2018. The scheme, billed as the world's biggest public health scheme, which provides an annual health cover of rupees 5 lakh per family with an aim to cover almost 50 crore citizens of India.
आज आयुष्मान भारत के संकल्प के साथ प्रधानमंत्री जन आरोग्य योजना पीएम जय आज से लागू हो रही है। समाज की आखिरी पंक्ति में जो इंसान खड़ा है, गरीब से गरीब को इलाज मिले, स्वास्थ्य की बेहतर सुविधा मिले, आज इस सपने को साकार करने का एक बहुत बड़ा अहम कदम इस बिरसा मुंडा की धरती से उठाया जा रहा है।
And according to the CEO of Ayushman Bharat, Dr. Indu Bhushan, in the first 100 days, around 6.85 lakh have been availed of this scheme. He said that, which is not even 1%. To mark the 100 days, country's Finance Minister Arun Jaitley in his blog described it as a game changer in healthcare system of India. In his blog, he wrote, and I quote, that many people from the weaker sections avoided hospital treatments in order to avoid the burden of an unbearable pay. Today, 40% of India's poor are assured of a treatment in a hospital at the cost of public expenditure. The outcome has been better than what we expected.
The Ayushman Bharat scheme is the flagship scheme of the central government related to provision of healthcare and medical facilities to the common citizens of India. It's bold, it's aggressive, it is big. It is meant to cover 50 crore individuals consisting of 10 crore families. It's the biggest such scheme ever attempted in the world. It is targeted to the common man who otherwise can't afford healthcare facilities, and it seeks to provide healthcare to the tune of 5 lakh per family. The entire rollout of the scheme, according to us, was hurried. A good scheme meant with a good intent, but if it is not well executed, it becomes a failure. So, while it is meant to cover 50 crore individuals, which is a huge number, as per the recent statistics given by Mr. Jaitley, so far 6.85 lakh individuals have availed of the scheme. Now, against a target cover of 50 crore individuals, 6.85 is not even a fraction of a minuscule. It's a very small number. And there are reasons for it. Where were the resources? Where was the infrastructure? Where was the commitment of all the state governments to implement the scheme in a full-throated manner? It was a half-hearted cooperation by governments also, because where do they have the funds for such an ambitious schemes? And even the central government's provision for this scheme was not enough. So, without resources, without infrastructure, without the commitment and involvement of all the state governments in the scheme, you can't expect full results out of it. A scheme which started, we say, with a good intent, but not a good execution, is bound to fail or is bound to have a much longer gestation period. Of course, it has taken into its fold other existing schemes which were going on of the central government, but lack of resources, lack of cooperation, lack of the state governments coming on board is certainly going to hinder any success that we might expect out of the Ayushman Bharat scheme.
Dr. Indu Bhushan. The CEO of the scheme had said that those involved in the implementation of Ayushman Bharat shared their feedback that it has been received well, better than what was expected. He further said, and I quote, "Even in greenfield states such as Uttar Pradesh, Bihar, Madhya Pradesh and Haryana that have had no health insurance scheme running in the past, in Uttar Pradesh, the number of admissions increased by more than 60% during the past 1 month. That shows the rate of pickup is remarkable." Contradictory to that, Dr. Ravi Vankirkar, National President of the Indian Medical Association, had said that the central government has the authority to claim anything, but the Indian Medical Association knows the ground reality. Let us hear what he has to say.
It's a doomed stillborn scheme, and it is going to spell doom for the entire healthcare delivery system of our country. Our Honorable Minister has all the authority to claim anything, but as Indian Medical Association, we know the ground reality. The entire scheme is an ill-conceived, ill-implemented scheme which is playing havoc with the healthcare delivery of this country. It is nothing but a political gimmick.
So is Prime Minister Narendra Modi's pet project really a game changer? The first fallout of this scheme itself is the budget allotted to it for 50 crore citizens is too low to give them proper medical aid. So the first question which arises is, how are you providing a cover to those many? Implementation of such a large-scale scheme and benefit is bound to face obstacle given the allocation of such a low budget. At the moment, hospitals are unhappy because, in their view, package rates fixed by the government are loss-making. So, for example, the cost of a coronary artery bypass graft that the Ayushman Bharat had proposed is about 90,000. Whereas the rate under the central government health scheme in Delhi is rupees 1.1 lakh, and the private hospitals routinely charge above rupees 3 lakh. Second question which arises in health is a common subject under the constitution of center and the state, where the state government is required to provide health facility. So the entire scheme announced by the center had to have the state on board. However, we know that the states like Delhi, Telangana, West Bengal, Orissa, Punjab and Kerala that together have a population of 256 million have opted out of the scheme. So we wonder on what basis Mr. Arun Jaitley is celebrating the success of its 100 days of Ayushman Bharat. Do let us know what you think in the comment box below. For more news updates, log on to www.hwnews.in.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.